Welcome to the Next in Health podcast. I'm Igor Belokrinitsky, a principal with PwC Strategy End, where I get to help leading health organizations with their strategies and operating models. We have a fascinating topic for you today, and to do justice, we have a fascinating guest co-host, Patrick Maher, who's a colleague and a friend from a long time back. And Patrick has brought some friends with him. So Patrick, please say hello and introduce yourself and tell us who you brought with you.
All right. Thanks, Igor. I'm Patrick Maher, a principal in PwC Strategy End. That's our strategy consulting business within PwC. I work with large hospital systems just like Igor does. Today, we want to talk about immersive technology and what potential that brings to enhancing healthcare experiences. Let's get into that conversation. Today, we're joined by three of our very talented colleagues. Ryan Caruso, he's a director leveraging emerging technologies to enhance employee and consumer experiences. Aparna Kumar, a director in our healthcare provider strategy practice. She focuses on clinical workforce development. And finally, Shay, a manager who works with hospital systems and payers to drive growth. Through experience, our colleagues will help us understand this topic of immersive technology, what it means for healthcare systems, and how to take advantage of it. Let's start with Ryan. Ryan, what do we mean when we talk about immersive technology? Could you unpack that for us?
Thank you, Patrick. Yeah, we see immersive technology as really the convergence of multiple different technologies that enable us to provide experiences that are more customized and engaging, whether they be fully virtual or just an overlay to real life. So really what we focus on here is XR, both AR and VR, and AI. XR brings that truly immersive or overlaid experience. AI can really be used to customize those experiences based on the audience or the context around them. We're going to go into this further as a group, but these really come together to make these experiences more personable, more effective, and more engaging. And these are all great attributes for things that will improve our healthcare experience and systems.
Excellent. Thank you for that. Now let's get into what this means specifically for healthcare organizations. And let's start with Aparna. Aparna, could you give us an overview of where immersive technology can be helpful in delivering healthcare?
Sure. Yeah, I'd be happy to. An area where there's immediate application of immersive tech modalities such as augmented, virtual, mixed reality is in the training of medical personnel. So let's actually start with an example of how this would occur traditionally today. You have a nurse or a physician who are training to get their license, and they typically interact with what we call a standardized patient. This standardized patient is a live actor who has been given a scripted case study, and they interact with these medical personnel around things like history, physical symptoms, what their diagnosis could be, what their treatment options are, bedside manner, etc. Meanwhile, the study of the actual anatomy and physiology of the body takes place through cadavers and, of course, literature review and so on. Now, imagine that this standardized patient is in an immersive reality environment where a simulated human body is designed with various medical presentations, physical and behavioral characteristics. It's virtually a library of every disease and symptom known to man. And physicians, nurses, allied health providers, any medical professional can interact with this virtual patient to learn and practice skills, study anatomy, understand literature, differential diagnoses, visualize in real time the pharmacological outcomes of treatments that are being proposed. It's really an incredibly powerful proposition. The application of immersive technology could even go further to engage patients to help them understand their medical condition, especially in chronic conditions such as diabetes, truly impacting patient outcomes through better adherence to treatment protocols, preventive measures, etc. In other applications, we're seeing immersive tech be employed in surgical procedures to reduce medical errors and achieve greater precision, and in rehab medicine to provide patients with an immersive environment to help aid their recovery. So definitely multiple applications, some of which are already being deployed.
Those are very cool. And Lily, it's your turn in the hot seat. So Aparna gave a few great examples of the use of immersive technology. Let's hear some more from you. What are some of the examples you're seeing today, and what can we envision in the future?
Yeah, thanks, Igor. So we've heard from Aparna sort of how XR, AR, VR can make clinician training more sticky. So then just imagine all the applications for really creating an exciting patient experience. Patrick, Igor, and other colleagues have talked a lot about experience on the podcast and how it's a really tricky area to master. And so we can really think about XR, VR, AR as another tool to sort of drive that experience that Ryan spoke about, more personalized, more immersive. So today, organizations are using XR, AR, VR in a number of ways already. One sort of exciting one for me is really around patient navigation of an acute visit. So imagine that you're going in for a surgical procedure and it's a hospital that you've never really been to before. And you show up to this building, it's multiple floors, 1 million hallways. And instead of being lost, not knowing where to park and stressed when you arrived, health systems have been shipping headsets to patients and giving them a turn-by-turn tour of what to do when they arrive at the hospital. So sort of taking the stress out of the actual showing up to the right place part of the visit. Then in the procedure, they've been walking patients through what will happen, what's the room you need to go to, what will happen when you're in there, but also showing them sort of what is happening in your body during the procedure. Again, sort of building this confidence for the patient that they'll know exactly what's happening in their body and understand why. And then as they wrap up the procedure and think about recovery, what do they need to do to make the most of their recovery? Is it physical therapy? Is it medical adherence? And really walking the patient through that through VR. And all of these things are really about building understanding and confidence for the patient about what's going to happen during this maybe scary visit. And not only does it build that understanding, but it also builds trust with the patient, which is key to really delivering on experience. So that's one of the ways that organizations are thinking about that today. And as we think about tomorrow and sort of all the possibilities that comes with this kind of technology as it matures and advances, we might expect that patients and consumers sort of have a digital health coach that's always there with them, sort of helping them make better decisions. Stretch after your 30-minute meeting, go for a walk because you've been sitting for 4 hours straight. Maybe try to go to bed so you get 8 hours of sleep, because that would be really nice, wouldn't it? So imagine it sort of as your angel on your shoulder, sort of taking you through your day and helping you make better decisions. And in this way, this tool, right, this virtual reality, augmented reality, becomes a part of patients' day-to-day wellness, as opposed to just sort of within the four walls of a hospital, and really looks to expand the opportunities for healthcare organizations to work with patients or members on staying healthy and happy.
Thank you. That's fantastic. And I think we're getting to a really important point here. Patient and consumer trust. Often, patients don't understand the process that they need to go through, their journey towards health. I do believe that the more we can inform patients and create a better experience for them, it'll only improve the trust factor and improve outcomes for patients and consumers. Ryan, I have a question for you. How do you see organizations getting started on this journey and leveraging the power of immersive technology and building it into their business?
Yeah, first and foremost, and we use this path as PwC, so we really walk the walk here, is you need to get your employees into the technology. And the only way to really unleash the capabilities of immersive and really any new emerging tech is to get your teams educated on it, to get them using it, and to get them to really understand the superpowers of the technology. And that can be done broadly through education and broad use programs, et cetera. And also should be done with small targeted teams that are really specifically enabled and focused and even incentivized to really push the boundaries of what can be done in the space. Learnings from both of these should be publicized across the company in a way that encourages engagement and collaboration and really taps into that interest and that desire to really expand horizons from the company and your employees. A parallel next step, and this is really where we have really recently gotten to in immersive, is finding those specific areas where it can drive the highest impact for your company. You know what your key priorities are. unleashing that power of your employees to understand how this new technology can really impact those, many of which have already been talked about in this podcast, is really key to make sure that you're focused that investment. We're seeing a lot of different opportunities take shape here with immersive, anything from optimization to customer and patient interaction, new ways of working. These are all areas we've seen results. And the impact is coming in many different ways as well, including decreased social distance, increased speed to impact, increased retention and fidelity from training, and ultimately just better outcomes with employees. And these are all things that we think are pertinent to the healthcare industry. The next step here is really to embed that technology into your organization at scale. So once you've found those opportunities that drive value, what do you do to really expand that value, find new use cases, but also further embed it in how you work? And that means getting this into your tech roadmap, working with procurement processes to get the new technologies and hardware available, working with change management, your recruiting processes, upskilling journeys, et cetera, to really build this into how your company operates in the fabric of it. And lastly, of course, is the measure and learn. Where are you reaping those rewards? What's blocking the big bets, et cetera? I think we all know this is a new space, so we need to continue to grow and continue to learn where the best application is. And the only way to do that is to make sure that you are tracking where those investments are, what the impact of it is, and really finding those metrics that help you tell that story and ultimately drive to further value.
Ryan, that's super interesting. And maybe as we bring this to a close, Patrick, final word to you as you've heard all of these great examples and suggestions from Ryan, from Lily, from Aparna. What stands out to you? What are you most excited about as the industry veteran?
Well, Igor, I think we're beginning to see the emergence of a new digital front door for healthcare organizations, one that's more accessible and immersive for patients. The results are going to be impressive. Not only will consumers better understand the process of healing that they need to go through, but I think we're going to see some significantly better health outcomes as a result. So bottom line, I do think that healthcare providers will need to start rethinking their digital front door strategies and building in immersive technology as we go forward.
That's fantastic. And thank you, Patrick, for joining. Thank you, Ryan, Lily, and Aparna.
Thanks, Igor. Always a pleasure speaking with you.
Yeah, thank you, Igor.
Well, this is such an important part of what is next in health. We put out our perspective at the beginning of this year, talking about how health organizations need to focus on new ways of engaging consumers, on managing risk, on optimizing their workforce, on achieving affordability. And these immersive technologies really help advance across all of that agenda for health organizations. It makes them really exciting, really special. And so I don't know if we've immersed ourselves in immersive technologies all the way today, but we certainly dipped our toes into it. So very grateful to our guests and the guest host. For more on these topics and other health industry insights driven by policy, innovation, and care delivery changes, please be sure to subscribe to our podcast. That way you also get access to previous episodes. For example, we've had a couple that Aparna joined us to talk about workforce shortages in healthcare. It's an evergreen conversation. Those challenges are still very much outstanding, and we have some great solutions for those. Until next time, this has been Next in Health.
This podcast is brought to you by PwC, all rights reserved. PwC refers to the U.S. member firm or one of its subsidiaries or affiliates, and may sometimes refer to the PwC network. Each member firm is a separate legal entity. Please see www.pwc.com/structure for further details. This podcast is for general information purposes only and should not be used as a substitute for consultation with professional advisors.